So maybe, how's this recording? How's this recording? How do you start recording?
I don't think it's going to stop recording. I think she's got it preset.
Okay. Alrighty.
I know. But we'll be able to edit that.
Okay.
Apparently I remember my sign in.
Uh-oh, that's the phone.
Yeah, okay.
Okay.
All right, and I'm gonna
We did it.
I'm gonna pull
trying
up.
to get rid of that other picture over there in the corner of my ECU stuff. People like, I'm sure the ECU. Get out of my bedroom. Get off my wall.
It's gonna be awesome. Okay, so let's, because I want to make sure that I have you, I have your PowerPoint up.
Okay.
And I need to make myself unavailable so I don't get interrupted with other.
I know I'm going to interrupt. I'm into my phone, cut it off. I think I shut down my email because if not, it'll be notified in the middle and you'll hear the bell ringing.
All of that. Like I put myself on do not disturb for my.
I'm trying to figure out, how do I do that? I don't know how to even do that on this computer.
I barely know if I'm doing it.
I need our executive administrator. It's usually like the one I always have to lean on for tech stuff. So I'm just like, oh, I'm always going, Oreo, help.
I think
Hopefully it won't ping. Let's see, can I cut notifications off? Like all the way? That would be great if I can cut notifications off. Is there a way to cut them off?
I see Jerry chatting with us that everybody can hear us and that there are 8 people with us so far.
Oops, sorry.
That's okay. I will let you do. I did not do all of my research with all the tribes here, so I'll let you do the acknowledgement. I do have I can add one, but I did not do my homework.
No, it's fine. That's why I told you I'm used to doing this, so it's second nature to me. So no stress. We got this.
Yes, we do. Right. So I'm going to share screen 2.
I'm still trying to keep this easier stuff out of here.
Okay. I hate that everybody can see all my stuff at the bottom.
Oh. And I need to. Is there a way to make me smaller and the screen bigger for them, or no? Is it? I'm going to see it smaller on my side.
I think you double click the screen that you want to see the larger your screen. I think they do.
Got it. Okay, I got it. So now I've got the PowerPoint up.
Okay.
And then I'm down at the bottom with you. Okay, that works.
Making all of these small. So everybody doesn't see everything. Okay. All right. I see in the chat that Jerry can see our screen. And everything is good. And they can double click on their screen to make it larger.
Okay.
All right. So we have a couple minutes and we'll get started.
All right, here we go.
Mm-hmm.
I know people can hear us, so I'm not trying not to talk loud, but like I'm one of those people for as much as I've done trainings and speaking and speeches and presentations, I always have like butterflies in my stomach every single time before, every time.
Yeah.
So I always have to keep saying, just breathe, Christian, you got this.
You got it. Carol says she's excited in the chat.
Oh yes.
And she says nervousness helps.
Okay. Oh, thanks, Jerry.
Oh, Samantha says she's excited too.
Don't be nervous. Oh, thank you, everyone.
So supportive.
Yes, I appreciate that. Carol's telling me to breathe. Thank you, Carol. I know. I have to keep reminding myself that too. Thank you for reminding me.
Wonderful. I see we have about 13 people have joined us so far, and we're supposed to start about 2:45.
Mhm.
And I'm pretty sure we'll have some stragglers.
Absolutely.
Right. Thanks, Lynn. We're excited that you're here. Okay.
Yes.
Well, we can go ahead and get started. And first, I want to thank everybody who is here and remind everyone that this is being recorded. So there will be an opportunity to view the presentation later on in the week. We greatly appreciate you joining us. And we are happy to bring you this presentation in concert with the social work section. And so we have Christian Adams from SisterSong, and we're really excited for her to be here. Christian, do you mind if I read your bio?
Sure, you can go ahead.
Christian's very humble, but she's a mighty force, and I want to make sure we give her all of her due. So Christian Adams is a mother, an activist, and native of North Carolina. She has over 16 years of combined work experience, which includes program implementation, training facilitation, grant management, community organizing, and clinical therapy. Christian currently is the lead trainer and membership development coordinator for SisterSong, which is the National Women of Color Reproductive Justice Collective. A lifelong advocate of women and children, she stands out as a skilled facilitator with a real-life understanding of social and organizational change that is grounded in social work best practices. Christian has achieved strong, sustainable relationships with community partners, stakeholders, and health professionals across multiple disciplines in the for-profit and nonprofit sectors. Christian combines both her clinical and community engagement skills to help others understand the multiple layers of social influence on people's lives. Christian understands the importance of knowing how to develop and support real-world policies. So she applied and was selected to be a 2020 State Fellow with the Georgia Women's Policy Institute. This fellowship is an intensive hands-on experience where she is learning to activate her community and advocate for legislation that will support women and girls at the state and federal level. Christian appreciates having the opportunity to work with people across the country to implement reproductive justice as the common thread that runs through the core of their institutional practices. Christian holds a bachelor's in social work and a master's in social work with a concentration of clinical and behavioral health from East Carolina University in Greenville, North Carolina, my fellow pirate. So with that, we have a big virtual welcome to Christian. And I do encourage all of you to engage with Christian through the chat. And if you need to make your screen bigger, please double click on the screen that you see has the PowerPoint. And with that, Christian, I'm gonna mute myself and go for it.
Thank you so much. Thank you for having me here, everyone. I appreciate the North Carolina Public Health Association for asking me to be a part of your virtual conference this year. Again, very much appreciative. I hate those bios. I am so humbled. I want you all to know out there in the virtual world that I am so approachable. So please chat in the chat box to me if you have questions. We'll stop at the end about 15 minutes prior and do a live Q&A for any questions that you might have as well. So before we go any further, it is important that we support the reconciliation efforts with Indigenous people. This is a part of reproductive justice. And to remind ourselves that colonization is an ongoing process. Native lands are still being occupied today due to broken treaties and deception within the United States. I acknowledge that where I am coming to you from today in DeKalb County, Georgia, which is on the ancestral home of the Cherokee and Creek tribes. Let's take a moment of reflection to honor the Indigenous people who we still live on this land with today. Thank you. So the name of this session is Achieving Equity Through Reproductive Justice. And when we're talking about achieving equity through reproductive justice, we actually want to first start off by talking about what is equity. So I'll ask the next slide to be advanced. So equity is the quality of being fair and impartial. It is assuring that everyone has what they need to be successful. Equity, like reproductive justice, speaks to accessibility, not choice, right? Equity speaks to safety for Indigenous people, for Black people, and people of color. We see that in terms like people of color, while there are terms that can be useful in some situations, that they shouldn't be used in reference to a specific race unnecessarily. So this is why you'll notice we actually list out Indigenous people and Black people separate. For instance, also, when you're referring to a Black woman as a woman of color, you could be also referred to her as a Black woman can undermine her specific lived experiences of being Black. So that's why we want to make sure that we're actually just not using people of color to group everybody into one category. Equity also is about understanding that we are all humans, that we will all have the same human rights. And then finally, it is not lumping all ethnic minorities together. The concept is literally thinking about how do we get to equitable practices? And how do we do that through reproductive justice? Advanced screen, please. So let's talk about what is reproductive justice. So reproductive justice, if you haven't heard the term, is a framework. It is a framework that was created by 12 Black women in 1994. And these 12 Black women created the framework primarily because it was able to be applied to advance public health through three means: improving health outcomes, promoting women's control over their health, and reducing the cost-related health disparities. And in addition to that, reproductive justice also serves as a major platform to both improve reproductive health and reproductive rights. So reproductive health, when we're talking about reproductive health organizations, we're talking about organizations like Planned Parenthood's public health departments, which a lot of you actually work in, clinics, maternity clinics, hospitals. These are our reproductive health entities. When we're talking about reproductive rights, we're talking about the entities that actually, the folks that actually fight for policy changes, normally on state, local, and federal levels. So some of those by name would be the American Civil Liberties Union, as well as the Center for Reproductive Rights in Washington, D.C., which is actually in their name. And then we have our good folks like the NARALs also, who have affiliates across the country that also do a lot of the work around policy changes and work in contingent with social justice movements. Next screen. So why is this framework reproductive justice? Why do we want to use the framework reproductive justice when we're talking about fighting for racial equity or for equity? Because it actually allows us to develop new ways of thinking, strategizing, and organizing. And I heard people say to me a lot of times like, well, I'm not an organizer, I'm a nurse, I'm a social worker, I'm a public health professional. Well, by the time we're done today, you're actually going to realize that you are grassroots organizers in your field, primarily because in this work, if you're actually thinking about equity, then you are organizing. You're having to actually talk to other people that may not necessarily understand what equity is and or aren't ready to maybe come along this journey without some additional education. So by the end, you'll actually be grassroots organizers along with the rest of us. And we also use this framework because it allows us to create new alliances that respect the leadership, experiences, and voices of women of color. And I know this morning I was listening at Tanya Bass' session. If you all were able to listen at the main stage session, Tanya talked about why we should value the lived experiences of individuals and count those experiences as literally like word of mouth, period. That is it. Lived experiences is what we should be looking at when people talk to us. So how do we begin to talk about their people's her stories, the individual experiences that are literally perpetuating trauma, perpetuating harm, and generational cycles of trauma throughout our communities? Why reproductive justice? Well, it also, by defining it for ourselves as Black women and women of color, we're able to actually define it as a common problem, and that common problem is reproductive oppression. And so we work to actually alleviate reproductive oppression, all forms of reproductive oppression, by securing our through human rights for individuals that we're fighting for. And we actually are rooted and grounded in the Universal Declaration of Human Rights. So we're going to talk about that in a little bit. And then additionally, while all women may theoretically have the same legal right to birth control, to marginalized communities, they may face economic, systemic, cultural, even language or immigration and religious barriers. What we know is that we may keep them from accessing their rights or genuinely having choice about their reproductive lives. So when we talk about reproductive justice, we're not just talking about choice, we're actually talking about accessibility and embracing accessibility for the folks that we're actually doing the work along for and with. Next slide. So you'll see my lovely triangle here, and in the bottom left corner, hopefully it's your left as well, you see the reproductive health. You're in the bottom right corner, you see reproductive rights. And again, we talked about who are those organizations. And the reason this is in the triangle is because reproductive justice is literally how the common thread that we can actually utilize to advance reproductive health and rights together. So it funnels in, both of these funnel into RJ. While the mainstream reproductive health movement itself has always traditionally prioritized abortion, and yes, SisterSong, we do abortion out loud, but while the mainstream reproductive health folks have always emphasized abortion as the singular challenge that all women face, reproductive justice and our movement for reproductive justice is created as an advocacy approach that recognizes the complex and lived experiences that impact Black women and women of color, reproductive lives, and actually limit our accessibility. One of the founding mothers of reproductive justice, Dr. Toni Bond, said, "We have to reconnect women's health and bodies with the rest of their lives." In short, reproductive justice can be described as reproductive rights embedded in a human rights and social justice framework used to encounter all forms of population control that denies women's human rights. And I'm actually going to take this a step further, and it denies woman-next human rights. And if you haven't heard that term, please know that woman-next is a term that is used to replace woman, so that we're actually centering our transgender folks that actually also live further at the margins than even someone like myself that is a Black woman, right? So we want to make sure that we're also being cautious and using our language appropriately and being able to change language to and be inclusive of all individuals. And reproductive justice does just that. Next slide. So now we're going to talk about these principles of reproductive justice. There's 4 principles, and you'll see them here. The main one says, decide if and when they will have children and the conditions under which they will give birth. So of course we know, we talk about conditions, a lot of times we may be talking about, okay, is that literally having a water birth, is it talking about hospital, but really it's talking about any conditions. So whether you want a doula or whether you want to have it at home, whether you want to actually be able to go into a clinic and the conditions that you have your child, meaning that you don't run into racism or have to deal with racist staff, right? So it encompasses all of those incidents under principle 1. Principle 2 is to decide, every individual has a human right to decide if they will not have a child and their options of preventing or ending a pregnancy. So here we're talking about abortion out loud as well as contraceptive, right? So we want people to understand that SisterSong and reproductive justice does include education around all forms of contraception. So not just certain forms. We do try to debunk the concept and understanding of just talking to people around long-actable reversible contraceptives, which are called LARCs. And we really want health departments, public health people, medical people, clinics all over to really be talking to people about all the different types and ways to be able to actually determine how they want to space their children and when they want to end a pregnancy or not, or how they're going to prevent from even becoming pregnant. That's what reproductive justice is. It actually allows our clients and the people we serve and work on behalf of to have autonomy, even in that space, to the highest level as possible, right? And then this third principle, to parent the children that we already have with the necessary social supports and in safe environments and healthy communities, and primarily without fear of violence from individuals or the state. This principle here, I tell folks when I'm doing these trainings and presentation, really touches my heart, because as a mother of 4, as a nana of 9, and 3 of my 4 are Black men, I am always thinking about how I show up in the work and have to live at the intersections of understanding that at any given moment, because I do have 3 Black sons, not that my daughter also doesn't face that, but even more so as Black men, they do face the possibility of having to always live in the state in fear of state violence or violence from police brutality. And so when we're thinking about reproductive justice, we really want to think about how are we allowing folks to also be able to show up in their fullest selves and to be able to cherish and parent their children to their fullest ability with the social supports. So I challenge all the time when we're thinking about, like, for instance, foster care system. We have, folks that are like, oh, we're definitely like for children rights. We want to make sure that all children have rights. And the first thing I ask people when they tell me that is, well, what are you doing around trying to advocate for policy change for the foster care system? Because this is a very big system that systemically perpetuates at disproportionate levels Black and brown children being taken away and put into systems that then at 18 sometimes puts them out with no place to go. And so how are we then actually actively moving to action to be able to be a part of the policies that very much need to be changed so that we're actually having equitable practices even for children beyond the fact of being able to be with a parent, so even in other systems. And you'll see as we go on that reproductive justice does actually look at all of the systems, and it is intersectional, and we're rooted in intersectionality as well. But before we talk about how we're rooted in intersectionality, I really want to talk about how we're actually rooted in the Universal Declaration of Human Rights and why. Why would this particular framework be rooted in the Universal Declaration of Human Rights? Next slide, please. Well, I'll tell you why, because any headline that you actually hear about or read about, whether it's on your local news, whether it's in a newspaper or magazine, I would probably beg to differ that 9 out of 10 times there is at least 2 to 3 human rights that are being violated. And I'm going to give you an example just to kind of like help you out here. What do I mean? So let's just take, for instance, we're talking about Flint, Michigan water crisis. In the chat, how many of you have heard of Flint, Michigan water crisis, which is still happening, by the way? I'm pretty sure. Yes, I see some yeses. Absolutely, you have. Absolutely. So when we look at Flint, Michigan water crisis, and this was a major headline for a long time. It's kind of died down now, but it was, right? And we think about why reproductive justice and equity is rooted and grounded in human rights. Then we think about, okay, within this water crisis, we automatically know that people's environmental rights were being violated, right? Because under environmental rights, if you can see the slide, it tells you clean water, clean air, no toxic neighborhoods, right? So we know that that's a given. But let's just look at, for instance, how do we connect developmental rights to Flint, Michigan water crisis and see that as a human rights violation? So what I always tell people is to think about, water is just what it is. It's a natural resource, except for the people that bottle up and sell it to us, right? That's my joke, y'all. So it literally is supposed to be a natural resource that comes from the earth. So if the natural resource in Flint, Michigan is water and water is being violated, then guess what? Developmental rights are also being violated. Oops. Well, let's just look at another one that's probably another obvious one here. Civil rights. Civil rights, absolutely, because it talks about equality and non-discrimination. Well, we know from reading the headlines that most of the water contamination that's happening in Flint, Michigan is happening in low-income communities of color. So there you go. That's at least 3 out of the 8 categories already. And I could probably go on quite a bit further to actually probably tie it to almost every one of these to show you how, even when you're watching your daily news, people's human rights are being violated every day, which then means they're not actually having accessibility to what they need to actually live their full lives, which then leaves us right back to inequitable practices, and then leaving us to the understanding of why we need reproductive justice to be used as this common thread to actually move us to racial equity and to equity throughout all of our institutions and organizations and the work that we do. And I often hear people say, well, is it really reproductive justice? I'm like, absolutely. And the reason we say that is because beyond the fact of reproductive justice being a human rights framework and rooted and grounded in human rights, it's also rooted and grounded in intersectionality. And how many of you know who coined the term intersectionality? If you know, put it in the chat for me. Who's the amazing scholar and lawyer that termed intersectionality? And you can move to the next screen, please. Who knows? I'm looking in the chat to see who's going to be the first one to put in the chat for me. Oh, Margaret, Kimberly Crenshaw, yay, absolutely. Kimberly Crenshaw is the amazing scholar, lawyer, activist, all things Black woman that coined the term intersectionality. And we often think about, well, why did Kimberly coin the term intersectionality? Well, Kimberly coined this term because she had a situation where she was actually, as a lawyer, fighting on behalf of this Black woman that was working at this automobile plant. And I like to tell the story because it's important to kind of help people to think about intersectionality and how all oppressions are connected. And so the Black woman was working at the automobile plant, but she was up for promotion and wasn't given the promotion, right? So she decided to actually take out a lawsuit for discrimination. So Kimberly happened to be the one that she came to take out the lawsuit. And what's amazing about this story is that when time to go to court, to actually bring her case before the courts, they pleaded her case. They talked about how, as a Black woman, she was up for this promotion. She was denied the promotion simply because of her being a woman and being Black, and wanted to be able to fight for, restitution for her. Well, what happened is that the courts, because the way the laws are set up, was like, well, no, actually, that would be double jeopardy. And so, or not double jeopardy, that would be like a double discrimination. And we really can't say like whether it was based on her being Black or whether it's based on her being women. And primarily because the judge said, well, because they have other women working there. But y'all, the other women working there were white women. And then he also described, well, but there's also Black people working there. And the other people working there that were Black men. Now, the Black men worked in the areas where they did the automobiles, right? And so they did the mechanic work and some of those other types of labor work. The white women were the white women that predominantly worked like in the front office area. And so the lady that Kimberly was trying to help was actually trying to move out of this middle section of working in housekeeping and had earned the ability and certifications and education to be able to be in the front office. But what happens is that often when people come into a situation like that, the judge really did not consider how this Black woman lived at the intersections of race, being a woman, and then because of living at those intersections, she actually never actually gets to have equitable rights, as well as being able to have accessibility to the things that she needs to live her life the fullest. And it's important to think about intersectionality in a way when we're also thinking about how we have clients that we work with, right? So most of you are in public health, whether you're social workers or you're nurses or you're, whatever. Oh, public health specialists. I have a sister that's a public health specialist in North Carolina. But whatever you are doing, whatever work you're doing, you're often running into folks and maybe not realizing it, but taking time to kind of step back and think about what intersections are your clients living at. Are they just living at the intersections of race and gender? Or could they potentially be living at the intersections as well as religion? Or maybe they're living at the intersections of classism in addition to all those other intersections. And maybe they're even living at the intersections of sexism, right? Because we do know that looking at the picture here, you'll see there's so many different classes of intersections that we all often are living at. And particularly when we're talking about marginalized individuals and we're talking about marginalized groups. So Indigenous folks, right now in the middle of a global pandemic, how inequitable is it that we actually have Indigenous people living on reservations that aren't even maybe possibly getting the information they need in the right time frame to talk about COVID and how to protect themselves from COVID, right? How are we actually making sure they're getting the resources they need? Because a lot of them don't have transportation and live in rural areas. So when I'm thinking about what's happening right now in this country, in the middle of this global pandemic, in the middle of the civil unrest, I'm always thinking about why reproductive justice is a means to reaching equity, and particularly racial equity in this country. So we're not talking about equality, we're actually talking about equity, right? And if you saw the first slide of my PowerPoint, I intentionally made that the first slide because equality and equity are different. And when we think about equity, it means that we all have the same playing field. We all have the things that we need. And in order for us to get the liberation, then we actually do have to reach equity first in this country. It is literally a commitment that we should be making, that racial inequities are to be disrupted in the United States, that we disrupt the practices and legacy of white supremacy culture that continues to harm those of us who are African American, Native American, Latinx, and members of other racial marginalized groups. It's not a choice, y'all. If there ever was a time, this is the time, right? Now is the time when we actually can do this work and do this work together. This is why we're actually doing trainings and presentations at rapid speeds virtually, because we really want people to be able to grab a hold to what does it look like to use this framework as a lens. So you actually are stepping away from your everyday lens that you've been moving through the world with, and you begin to use this reproductive justice lens that actually centers 4 key components. And we're going to talk about that on this next slide. So the 4 key components of reproductive justice you'll see here. And you should always be actively asking yourself these 4 questions. This will let you know if you're working towards equity, because remember we said in the beginning, equity is like reproductive justice in that it literally leads to accessibility instead of choice. So we center the most marginalized always. We work to achieve human rights. We work to dismantle white supremacy culture. And we understand and implement intersectionality. Those 4 key components make up the analytical framework and theory of reproductive justice. It is actually designed such that we're always keeping front and center those that are even more marginalized than ourselves. And in SisterSong, we're a women of color reproductive justice collective, but we still have to understand that as the country is evolving, so is our understanding of community, our understanding of how people want to be identified. And so for us, we're always, as Black women, as women of color, making sure that we're centering our LGBTQI families, brothers and sisters, as well as our transgender brothers and sisters, because we want to make sure that their voices are amplified even before ours in many spaces, because they live at even greater intersections than we do, right? Each and every day. And when we talk about white supremacy culture, because a lot of times people are like, well, why do we have to work to dismantle white supremacy culture? Well, in order for you actually to do racial equity work and reproductive justice work and hopefully public health, and be working to eliminate all forms of reproductive oppression, then you understand that the culture that we live in of white supremacy is literally structural and holds and amplifies structural racism at every entity, whether it is the medical industrial complex, whether it is nonprofit industrial complex, whether it is the education systems, whether it is, I don't know, you name a system, is held up environmental justice systems, every system that we live in. Matter of fact, I'll just go as far as telling you this, and this came from one of my colleagues, Jaleesa Jackson, and I love her, young, Black, amazing, queer femme. She says, white supremacy culture is the water that we all swim in. So even us as Black people swim in the water. So none of us are removed from being touched by white supremacy culture. So even in order for us to do our work around equity and reproductive justice, we're always checking our biases. We're checking our conscious and unconscious biases. We're always being self-reflective, and we're always reminding ourselves of these 4 key components. How are we actually working to achieve human rights for all individuals? How are we actually working to implement intersectionality and to center those that are more marginalized than ourselves? And then how are we actually disrupting the systems of white supremacy culture in which we all live and thrive? Because without that disruption, it's going to be hard for us to achieve equity. So individually and together, in order to achieve equity, in order to achieve reproductive justice, we must be willing to dismantle white supremacy culture. And I make no certain chance of saying, every time I get a chance, that if you are not actively working to dismantle or disrupt white supremacy culture, please know and hear me clear, and this is for the people that'll probably watch the recording afterwards as well, then you are actively upholding white supremacy culture. There is no fence to straddle. You don't get to be on the fence and be like, okay, well, in my work life, I'm gonna actively disrupt white supremacy culture, send the most marginalized, and fight for equity. And then you go home in your personal life and you won't actually talk to the people that you rub elbows with every single day. You won't have the hard, tough conversations because you're worried that you're gonna offend a family member. I tell people all the time, I want your mama, daddy, cousins, sister, brothers, and all of them, because without all of us, we can't get to liberation. It is literally going to take all of us. But if you're not having the tough conversations, if you're not actually doing the work, then you're actually upholding the systems that are actually perpetuating the trauma on the very clients that you're serving. And much like Tanya said this morning, it's so funny when I was listening to our presentation, I was like, oh my God, somebody else actually believes when they went into school and had a school that said the best social workers, the best way to know that you're doing the work you're supposed to be doing is when you work yourself out of a job. And people get scared by that because it's like, well, what are we going to do? But I challenge you to stop thinking around scarcity and really to think from an abundance model. To think from an understanding that if you're working yourself out of a job, there's other things that will come, but that is the only way for us to know that people are actually getting to assess the services and the things they need to actually have equitable lives, right? To live lives that are full, to live lives that are actually free from reproductive oppressions, to be able to support and take care of their families, to not have to live in fear of state violence or individual violence, and to actually be able to live and thrive in this country that actually says we're supposed to be the United States of America, right? The land of the home of the free and the brave. And I challenge us to think about when we are saying those things, how are we being a part of making sure that we're doing just that we all get to live in the land of the free and the home of the brave with the same equitable supports as everyone else, that the color of our skin does not stop that. So as we talk about, equity and reproductive justice, and we talk about, well, what would that look like, right? What is the vision for being able to use reproductive justice? What is our vision? What is SisterSong's vision? What is the collective vision of Black women, women of color around this country? Well, the vision is, it is when all people have the economic, the social, and political power, as well as resources to make healthy decisions about our bodies, our sexuality, and reproduction for ourselves and our families and our communities in all areas of our lives. It's just that simple. Not a lot to it, no ifs, ands, or buts. Literally, we're talking about understanding accessibility, understanding how bodies are not being exploited, how bodies are actually being treated the way they're supposed to be as human beings with humanity. What has happened to the humanity, I often ask, in this country when we're talking about those of us that live at the margins, that are always trying to fight to understand where do we fit in into this country. And so we move on to what are the parameters for applying reproductive justice? How do you apply reproductive justice? And you can move to the next screen, please. What are some of those parameters? What are the criteria that any organization, so not just a social justice organization, because people often say to me too in trainings, well, that's for social justice orgs or activists or people protesting. And I'm like, no. If you say that, then you're actually saying that you're limiting the framework that Black women actually created. And this framework is not limited just to our communities and to African Americans and or to social justice movements. It is literally a criteria and movement and framework that can be used in any organization. You may help reformulate your missions. You can use it to work to embrace the framework of reproductive justice, to use it again as a lens while you're actually providing services. But the main thing is just to remember that you don't co-opt it and make it your own, right? Because we know that Black women's intellectual abilities have continued to be co-opted in this country and taken for other folks, and we don't want that to happen. But as we look at these parameters of how you can apply RJ, you'll see a few of them here. Intersectionality. Issues must be interconnected. We don't live in silos, right? We actually should be breaking the silos. I worked in Durham County for like 5 years, y'all, before moving to Georgia. And that was one of the main things I loved about the Triple P Positive Parenting Program. If you haven't heard that, it's through a lot of your public health departments. Now it is run through the state maternal child health branch. But that program to me really broke down a lot of silos and barriers within North Carolina, because it actually challenged those of us that were running the program, working to get people trained to really reach across different sectors. So we actually trained folks in nurses, that were daycare providers, that were in hospitals, that were in schools. So it really began to start connecting and beginning to show the interconnectedness of what it looks like to actually live and be able to talk about intersectionality, right? So that's a very good program. You should definitely look it up. And if you live in Durham County, they still have the program in Durham County as well. Connects the local to the global. Here we go. What's happening right now in the United States? People say, oh, we're in another moment of civil rights moment. Actually, we're not. We're actually in a global civil rights movement, y'all. Instead of it being just in the context of the United States, the movement that is happening right now because of COVID-19 and the killing of Black people is literally a global civil rights movement. It is the biggest civil rights movement that has ever happened in this history of time, because it is global. It is not just talking about the local incidents that's happening within the US, but you hear people all over the globe coming out and protesting and talking about how this is the moment in time for us to move the globe, the country, the world forward in this work around equity. It's based on the human rights framework. We talked about that quite in detail. Makes the link between the individual and community. So again, no more silos. My favorite President Archie Lord said, we do not have single issue movements because we do not live single issue lives. We absolutely do not. Even as I sit before you right now, we're always thinking about how do we begin to actually amplify the fact that individual and community is together. And as a social worker, that just suited me perfect with reproductive justice, because I always was like, oh, well, I understand that in order for you to do good micro work, then you actually have to also have folks doing good macro level work at the higher level. And then there's also this level where people a lot of times forget, but I didn't forget. It is the mezzo, which is the middle part of the work. So in order for us to actually be able to do this work, we all have to be thinking about all three different layers of the work that needs to happen individually and collectively to be able to move equitable practices forward. It addresses government and corporate responsibility. Y'all, I'm not even going to harp on accountability, but this is the moment for accountability at levels that we've never seen before. We want people to really hold themselves accountable, to hold organizations and institutions accountable. If you're in an organization or institution and you see there's race inequitable practices happening, please speak up, please speak out, use your voice, because you may be the only one right then that actually has the opportunity to speak on behalf of clients that will probably never get the opportunity to say that to someone that's within that health department on a higher level. So please use your voices to actually work on behalf and in contingent with the folks that you're serving. It fights all forms of population control, eugenics. Tanya was talking about it this morning. Y'all, when I tell you, I was like, Tanya, I don't even know if I need to do my session because you literally like, we on the same wavelength here, right? So I'm just going to tell y'all that the universe is obliging and everybody that attended this conference is getting like a double dose that's on the session this afternoon because literally this is the work that the universe is calling us to do. To really, really, really like dig deep as a country, as a world, to really take a hard pause in time and get back to what really looks, this country should look like, what was intended for this country beyond the Constitution, and that really was implemented when the Universal Declaration of Human Rights was developed at the United Nations in 1948. And that's that all individuals have the same human rights afforded to them, regardless of race, age, sex, any of those discriminatory and intersectional means that they live through, right? It puts marginalized communities at the center of the analysis. You always should be a center in the marginalized communities, always, always, always. And I love also that it understands that political power, participation of those impacted, and policy changes are necessary to achieve equity. And the reason I think I love that one is because oftentimes when I'm going to trans, people say, well, I don't want to get in politics. I vote, but that's it, as far as I want to go. And I tell them, I said, well, I can understand that, but if you just told me that Black Lives Matter, and then you turn around and say that you don't want to be in policy or involved in policy, I mean, you don't got to be out here like at the Capitol every day or talking to legislators, but you literally should be like reading and studying. And if there's petitions that come across your social media platform, could you add your name to that for us? If there's someone saying, well, hey, there's a policy that we really don't need implemented, could you write to your senator or congressperson on behalf of us? Because that's literally saying that Black lives do matter. That's literally saying that you do value and understand that we actually need political power structures to be broken. It is a part of the cultures of white supremacy, right? And if we're not the ones, those of us trying to fight for equity in public health and other social justice movements, then who really is going to fight for us? Who's going to be the ones to make sure that policies are policies that actually protect and value all human beings, right? And again, it applies to everyone. So this is why and how we can apply reproductive justice even within an organization that doesn't consider themselves necessarily a social justice movement, right? Or a social justice organization. Next slide. And so this is one of the slides that I really sat down, and when I was asked to bring this presentation, I was like, what are some of the things that I actively can say that public health professionals can do to support the fight for equity? How do I get those people that are going to be in this presentation to actually see themselves being able to have some tangible tools and tangible items that you can walk away with to be able to think about how you can move this work forward using a reproductive justice lens? And so here's a few of the bullet points I came up with. The first one says, recognize and challenge the intersecting systems of oppression. Absolutely, right? We've been talking about intersectionality. We've been talking about how do you use your voice? How do you amplify the voices of those living at the margins? So not just recognizing it, but challenging it, giving the pushback. I just said that. If you're in places and you see it and it's happening, then if you're not actively challenging it, then you're actually upholding those systems and allowing those systems to continue to harm the very clients that you're trying to serve. And I would actually say to you that if you're doing that and not actively challenging, then why are you even in the work that you're in? Because you're allowing the trauma to continue, right? Just something to think about. I mean, I don't know. You might tell me afterwards in a live, Q&A that was not nice, Christian, but I'm just saying that's my thought on it. We want to be able to create an organizational culture, and this is on you, public health folks, that encourages communication and learning around implicit bias, institutional and structural racism, and how these issues play out within the workplace and in the problems you work on. I read that slow because I really want y'all to catch that. There has to be organizational communication that is happening and learning that is happening to be able to move those that are ready towards the understanding of what it looks like to work towards equity, right? We can't reach racial equity if we're not having the tough conversations, y'all. If we're sitting back in institutions or organizations and we're not having the conversations, we're doing an injustice to the people we're serving. And beyond that, I also challenge you to not just try to do this work as just your professional work, but to live it in your personal life. You should be moving throughout the world such that you're always understanding, asking yourself those four components we talked about earlier. Am I centering the most marginalized? Am I actively working to dismantle and disrupt white supremacy culture? Am I using and fighting for human rights for all individuals? And am I looking and working at the intersections of systems that are affecting the very people that I say I'm doing this work in contingent with on behalf of? If you're not doing that in your personal life, people, it's gonna be hard. You will get called out. People will call you out and leave you out there. Because it's hard to move throughout a world right now in this day and age and try to carry two different sets of lens. And I came up with this analogy at a training a few weeks ago. And I said, it's almost like there's some people in the world that move around the world and they do work, whether it's medical practice people, whether it's public health, social workers, nurses. Y'all, I train people in all fields, right? Teachers, university students, doesn't matter. But in so many conversations, I keep having this, okay, well, I'm good with actually having the conversations at work and with the people around me. But when it comes to me having the conversations with like my grandpa, mom, or my uncle that's like a Trump supporter, I can't do that. And I'm gonna tell you what I tell them. You not doing that means you're actively holding up white supremacy culture. Please step aside, let whatever role you're in whatever organization be give to someone else, because you're actively perpetuating trauma and harm. These are the conversations. This is the work. This is not a sprint. It is a marathon. We will always be doing this work until we all get to liberation, right? But what we cannot do is to continue to allow people to sit on the fence or to wear their reproductive justice / equity lens when they're at work. And then, as I say, go home and put back on your white supremacy lens. I'm just going to tell you, you're going to get caught. And somewhere down the line, you're going to mess around and forget to pull off that white supremacy lens when you work into your workplace. And somebody going to be like, gotcha. So it's better just to make a decision, make the autonomy for yourself, and be like, you know what? Absolutely, this is the decision I'm making. And here's the amazing thing about Christian. I'm still going to love you, even if you choose to not be in this work with us. Because I much rather you say that and have autonomy and stay on the banks. And I say the banks because it's like we're going across the river like in Harriet Tubman. Because when this revolution really kicks off and we really start moving the revolution forward, what I don't want to see happen is that some of you get cut loose in the middle of the river and you sink and don't make it because we couldn't keep toting dead weight. So just stay on the banks. Be okay with that. We're going to be okay with you. And we're going to take all those that want to go with us, and we're going to go ahead and move this revolution forward. And then when you see us at Liberation, you can just come on out the banks and come on join us, right? Absolutely. It is an amazing, beautiful thing. This work is literally my life work, right? I tell people it is my lived experiences. I do this work not just because it's about getting paid. It really is because I have lived through so many experiences as a Black woman that I don't tolerate any mess doing this work. And I live in my power and stand in my truth every single day, because it literally is about protecting those folks that live at the marches to prevent them from ever having to live through some of the traumas that I've had to live through myself during my lifetime. And what else can other public health workers do and professionals do? Promote policies and clinical practices that facilitate needed family support like childcare, housing stability, and transportation. I'm gonna read that one again, because often we're in these public health entities that put out programs, but don't ever think about how you're actually gonna provide childcare, housing, and transportation. It's not equitable to write grants for programs and don't think about how you're actually providing for the families that you're asking to serve. Period. As my daughter would say, that's it. Absolutely, that is it. And yes, is this Cheryl? I don't want to pronounce somebody's name wrong. Whitfield. White silence equals white consent. Absolutely. Absolutely. And white silence actually equals white violence too, y'all. I hate to tell you, but it's real. It's legit. So thank you, Ms. Whitfield. Thank you so much, because you're absolutely right. It does. And we literally have to be saying that and making sure that we're voicing it in this particular moment. You can also implement new requirements for public health professionals to participate in annual training. So much like Tanya, I don't want people getting trainers to check a box. If you call SisterSong because I'm the lead trainer, one, you got to go through a phone call with me and be vetted, because I need to see where you stand, what your priorities are, what your purpose and goal is. And then I'm also going to have you set internal and external goals for your organization that you're going to work on. And then we're going to do a technical assistance follow-up in 6 to 8 weeks to see if you did it. If you don't believe me, talk to people at the state level that I've been doing this with already. I don't play. You don't get to check a box. So if you're going to do this training and address the inequities in care provided to Black womanettes and their children and all people of color, then just make sure you're doing it because you really are ready to move towards implementation. Implementation is the key here, not checking the box. Actually getting the work done this time around, right? While we have a time to get it done. You can also promote policies that expand coverage to the under and uninsured and reduce the linguistic and cultural barriers to care. Same as the one before, y'all. We can't keep actually trying to do this work without considering those that are living at the margins and what are their needs. A main way of doing that is focus groups. Building and writing in focus groups to your grants. Having people actually go out and do surveys. My most prized professor, and she's gone on now, Dr. Leslie Bass, started a intergenerational community center in West Greenville when I was in my last year of undergrad. And this was in 2008, y'all, because I went back to school as a non-traditional student. And what I loved before she started that intergenerational community center is that those of us that were undergrad social work students that wanted to work and be a part of this actual project had to literally go door to door doing focus groups and surveys. And we went into the community of West Greenville and we went door knocking with surveys to ask people, what would you like to see in an intergenerational community center? What things would be beneficial for you to have there? What would be beneficial in this community? And like, it was amazing. And I never forgot it, because the way that she actually created the intergenerational center and the way it still stands today is because it was actually the community that involved themselves and actually had a voice to say what happened. They have a garden there. They still tend the garden themselves. They have access to computers where they can go in and do resumes and look for jobs. They use it because they actually were able to say that's what they wanted, y'all. And it is amazing when I look back and think it's 2020 now, 12 years ago, because we were able to go into that West Greenville community, which is predominantly a Black community, if you don't know, and literally door knock and ask people what they need. The people there are still using that facility to its fullest, and it's still being funded even today. That's what it looks like to build equitable programs in communities of color. That's a great example. Look it up. The Intergenerational Community Center. It's the Lucille Gorham Intergenerational Community Center in West Greenville. Y'all in North Carolina, so you don't got far to go to look for it. And you can tell them Christians told you about it. I think Dr. Deborah Moody is still the one there running it now that Dr. Bass has passed away. But yeah, tell Miss Moody if y'all go by or see her that I said hi, because I haven't seen her in some years now. And then finally, but not last, another very important way that public health professionals can support this fight for equity is to work in coalition with social justice organizations that do not normally focus on reproductive justice issues. And the reason I say that is because we often have people say, well, okay, we work with like Planned Parenthoods, NARALs, we're in groups with them, we have coalition groups with, affiliates that do reproductive health and rights work. Great, kudos. However, what about environmental justice organizations? How are you working in coalition with those folks? How are you working in coalition with the people that are fighting for economic justice, for living wages, for the very people that you're actually providing services to? Aha, yeah, got y'all then. So we're literally asking you to think about, again, how are you being intersectional in the very work that you're actively doing? And in order to do that, and to expand beyond reproductive or health rights or justice organizations, how are you actually looking into those other social justice organizations that also continue to be an issue for the families that you're serving? How are you being impactful in that way? So before we go on, I've got a couple different takeaways, and we're gonna have a little bit more time than I thought for Q&A, but I wanna look in this chat here because I see people giving me some really good feedback. Oh, there's a Kinston native here. I know all about it. Yes, absolutely. Oh, I see it. That's my moderator. I forgot you said you're from Kinston. Yes, absolutely. Clarissa speaking, yes, the perspective game being a Black woman in this nation is hard game, period, poo. Yes, period, poo. I couldn't think of the last part of that. Thank you, because that's my daughter's 20, y'all. So she always be saying this stuff, and I'd be like, well, I gotta use that in my training. Period, poo. That's what it was. I missed the poo part. But yes, absolutely. Let's see what else we had going on in the chat. And y'all, I know, when you're thinking about equity too, like folks are always asking about resources. So I did send to you all, and I will make sure, because someone just asked about the PowerPoint. I see that. I will actually send a PDF of the PowerPoint so that it can be given to you as well. I also sent a suggested reading list that you all that will be available to all attendees, as well as a couple different articles. One of those is called What is RJ? And it is done by a young Black woman that did it probably a few years back now, but it really does go into reproductive justice more about her story, why narrative and narration of the stories are important and cultural for women of color, for Black women and people of color, and how that can be beneficial in the work that we're doing around equity, is to not always think about the quantitative information, but how we also thinking about the qualitative stories that are very valuable and can be used in different ways to also fight for policies and to have policies changed around as well. So for our final takeaways before we do Q&A, I've got a couple different slides here, and then we're going to be done with that. So the first set of takeaways says, and you can advance this slide, please. Remember that reproductive justice challenges us to think about who is benefiting and who is not benefiting from white supremacy culture. That is absolutely also should be a takeaway from thinking about racial equity work as well, right? Because we said that equity actually is talking about, like reproductive justice talks about, accessibility. So in order to talk about accessibility and to not be talking in this choice mindset or framework, we really do have to think about who is benefiting and who's not from white supremacy culture. The work has to be done in partnership, again, with marginalized communities. Always remember to amplify their voices. Teach them how to do the advocacy for themselves. Don't always do it for them, right? So we want to make sure that we're allowing them to amplify their voices and that we're standing alongside of them. The most important thing, and I should have had this takeaway up here, but I know it, that's why it's probably not here, that you can do in this work to build equity, racial equity, to achieve racial equity, is to actually build authentic relationships. And when I say authentic relationships, I mean being able to walk the walk with individuals. You take my hand, I take your hand, and we do this back and forth, right? So with the people that you're working with, you're not just always giving or doing for them, but you're actually working in contingent with them. You're allowing yourself to be pulled and to go back and forth so that you're hearing what they're saying, you're able to helpfully give resources, and then being able to then give it back to them so they can then amplify their own voices. We need folks to be able to stand in their own power and truth around what they need for themselves. It's necessary to continue being vulnerable and curious when using a reproductive justice lens. Be vulnerable, y'all. Get uncomfortable to get comfortable with the understanding that this work is the work that has to be done if you're actually going to do greater work around race equity and public health. Reproductive justice is the common thread that should run throughout all of your work, primarily because it centers everyone's human rights and it works from those intersections. Dismantling racism, sexism, heterosexism, and unlearning oppressive attitudes will and does take a lifetime. If anybody tells you, oh, I did my anti-racist work and I'm good, have a side-by conversation with them and then reconnect them with some more resources, because they should not ever be saying that. This is life work. We're always going to be having to check our actions and be self-reflective of where we are and how we stand and how we move in this world. Because again, I said earlier, we all live in white supremacy culture. It is the water that we're all swimming in. We can't get away from it. So we always are going to have to be checking our own selves. None of us are beginners. None of us have perfect clarity. This work is a journey without an endpoint, including for me. It is a journey without endpoint. I am always learning. I'm always gaining new knowledge, reading books, reading articles, asking questions of my elders through the movement, across movement. I just had a conversation the other day with a young lady that's in New York that is actually trying to start a mobile clinic, reproductive health clinic. And it was so amazing to hear from her as a nurse and a midwife what's important to the people in Mississippi, right? Because what I don't want to do is go in there and try to use the same training I use with folks in Montana, with folks in Mississippi, because it ain't gonna work, right? So I'm also always thinking about, how am I walking in the world? How am I holding myself to a higher level to be able to make sure that people are able to diverge the information, regurgitate the information, and then be able to continue to divulge it and regurgitate it as we need it to keep ourselves moving, right? So we should always be chewing on it, thinking about it, putting it out, taking some more in, chewing on it, thinking about it, putting it out, so that we continue to also evolve just as the world is evolving around us. We can't stay stagnant, because if we stay stagnant, then the world continues to evolve and we're just complacent in what we've always been doing, which is partly why white supremacy culture thrives as much as it does. Period, Pooh. I got it that time. And so for the last final takeaways, we want to remember that reproductive justice, like racial equity, challenges us to think about who is benefit. Oh, did I get to the wrong 2 slides? I might have did the one before, huh? Let's see. I'm moving too fast for myself, y'all. I apologize. Let me get to this next one. Okay, so remember that racial equity challenges us to think about who is benefiting and who is not benefiting from white supremacy. So again, both do the same. This is why we say that you can achieve equity, racial equity, through reproductive justice. The work has to be done in partnership, again, with marginalized communities. Support local, state, and federal initiatives that advance social justice. It is necessary to continue being vulnerable and curious when discussing topics like racism. So it's not just enough to continue to be vulnerable and curious in your own work and in your own, for your own self, but also when you're talking about topics around racism and white supremacy culture. You have to be able to be open to know that, yes, someone's going to hold you accountable if you say something wrong. Apologize, keep moving on, keep doing the work. Be committed to doing the work, even if you get called out, right? And find somebody or somebodies, so it could be multiple people, that can hold you accountable in the way that you'll be accepting of the way they hold you accountable, so that you'll actually move forward in the work, right? Because sometimes you can get connected to somebody that holds you accountable and you like, oh, I can't take it that way. Then just find the next person. Don't quit the work. Don't let that be the reason, be like, well, they hurt my feelings and I'm not going to do this anymore. You know what I tell people? Put your big girl, boy, folks panties on and do the work. We don't get a chance to actually sit around and be like, oh, okay, I got my feelings hurt. Our feelings are going to get hurt. My feelings get hurt. My elders sometimes tell me, okay, Christian, wait a minute. We need you to do it this way. Okay, cool. Constructive criticism is the best criticism. I am the lead trainer today, and I firmly believe this because those elders, those 12 Black founding mothers of reproductive justice, particularly Loretta Ross, sowed into me and believed in the fact that if she continued to sow and continued to actually take me down this journey with her, that I would be the facilitator I needed to be to do this work. And it proved to be true, y'all. And she holds me accountable at a level that I'm okay with and continues to challenge me to keep doing the work and to keep pushing forward, because we know that we can't stop. So before I take questions, I've got one final thing I'm going to read to you all. And I think it's important to read this because I had posted it a few months back on my Instagram, and all of a sudden I had about 4 or 5 different white women that follow me reach out and say, dang, you're right. And I was like, I'm right. And I was like, I'm right about what? And then they led me back to this post that I had did a few months back. And I went, wow, I actually did that in the moment of being in tears and thinking about what was happening in this country and how I was seeing that particularly suburban white women, again, were not standing with and alongside many of them, Black, Indigenous, and people of color in this country in a time when we needed them the most. They didn't stand and stay with us when they decided to go help vote Trump into office. And I'm speaking facts. If you don't believe me, do your research. That's part of the work, is for you to labor for yourself. But suburban white women are the reason why this administration exists today. This administration that continues to ignore, to incite racism, to ignore Black and brown people in this country, and continue to incite fear to a level that literally has those of us that literally live at the margins already, continuing every single day to be on the front lines, whether it's protesting, providing educational presentations, providing reproductive justice trainings, going to detention centers to stand out there to declare they be shut down because women are being literally sterilized without their consent. Whatever it may be, all of these catastrophes are happening because suburban white women didn't stand with us in 2016. And I made up in my mind that night when I wrote this, that I was no longer going to be silent and not voice my opinion about what that should or shouldn't look like, and to call them into this movement, this work, with an intent to be loving, but also to be firm and to stand in my power. And so I wrote, white women who want to be allies or accomplices in this work around racial equity and reproductive justice, but remain silent about racial inequities in your home and with your family. These questions are for you. What is your fear of educating your family and closest friends about racism? What is your fear of challenging the white men in your life to become anti-racist? What is your fear about boldly protecting Black people and other marginalized people in this country? Grapple with whatever it is that causes you to shrink in fear, because your perceived fear is white supremacy being upheld. Deal with your fear, because your fear is also white violence. I challenge all white women working towards racial equity to push beyond surface work, to go deep within, to do the real work that has to be done to disrupt these systems of white supremacy culture. This won't be easy. I know it will not, but this is the work for you to do. We can achieve equity. We can achieve reproductive justice. We can't eliminate racial disparities if we're not being real with ourselves. If there ever was a time in history to do the work that is necessary for all of us to have every human right afforded to us to be honored, it is now. Because like every good movement, we know there is a window of opportunity. And when that window of opportunity closes, it's hard pressed to get anywhere. So let's do it together. Let's work alongside each other in contention to bring equity into achievement by securing the human rights of those living at the margins, so that we all make it to liberation. Thank you. And I'll take questions now, and you can move to the context slide so they can have that if they would like.
Thank you, Christian. Awesome presentation. And I know folks are confused in the chat. So I have employed my best friend and colleague to make sure things were working well on the back end. So you see two Michaela Penixes. The other is
I was like, wait.
Clarissa Gooding H, who is and supporting us today.
Thank you. So do you have any questions? Sorry, go ahead, Michaela.
I see folks are clapping, giving you lots of kudos.
Thank y'all, absolutely.
Someone said they almost started to clap. I was clapping. I said, Lord, I'm glad I'm off camera, because I was rocking in here and clapping my hands. It was very, very good.
I could feel the vibes, y'all. I could feel the vibes in the chat. So thank y'all so much. When the chat is dead, then I'm like, oh, Christian, you probably didn't want to say some things, right? But the chat has been bumping. So yeah, I appreciate all the good vibes. I'm taking it all in, y'all. Truly humbled. I'm just thankful to be able to do this work along such amazing folks, even like yourselves, like doing this work, like y'all, we can't do it by ourselves. So thank you all for your work, for your time, for coming to listen to this session, for being a part of this conference. There's so many good titles I was looking through. So I'm just like super ready and charged every time I have the opportunity to educate folks, because I know that we're going to make it. And I don't mean like after I'm gone. I mean like I'm gonna be here when we get to liberation, y'all. I'm ready.
Well, it is my goal to make sure that that we have you again, Christian. I think this was an awesome opportunity for social work and the women and children section to collaborate to make sure that reproductive justice is at the forefront of public health. We do have one question. Sure. So the question is, what coping mechanisms do you use when doing this work?
Ooh, why do I always get that? Okay, y'all. So do y'all mind if I get up for 1 second? Because I got an amazing book that I want to share with y'all. It's called Radical Self-Care. Matter of fact, I can tell you, it's Sonia Renee Taylor. It is like a purple book with Sonia Renee laid on the book itself. I got that book, it's probably year 2 coming into this work in reproductive justice. And so how I actually take care of myself is, y'all, I literally take radical self-care moments, right? So like Friday, I'm not working this. I'm calling in Black. I just think like, you know, it's just the thing that all orgs should do for those of us that are Black and brown, because like literally we're having to hold so many things every single day in addition to our work lives and personal lives. So that's one of the things I literally don't have a problem anymore. I used to be that one that was like, oh, I can't call in to work. My vacation days at the end of the year, they're like, can you please take vacation? You lose it. But now, like literally walking into year 2, Loretta was like, baby, even though I'm not, if you don't take care of you, you won't be able to continue to do this work. So I take pauses in the work to be able to take care of myself, whether it's just sitting at home or relaxing or being with my daughter or my grandkids. I take opportunities to spend with my children, particularly one of my sons lives here while my daughter's away at college. And so I spend a lot of time with family. I also, y'all, literally will step away in a minute and be like, okay, I just literally need to like not look at books, no work, no nothing, and just sit in silence, right? And literally sometimes it's just me just laying in silence to see what is speaking to me, what is being said, where do I need to go? And I'm always contemplating and meditating how I'm actually showing up in this work to be able to actually reach those that my purpose is here to reach, right? Because I believe that I was purposed for this work. I also have a good dose of wine. I hope that's not something I couldn't say. Sorry, y'all, I'm an RJ and we live in our full selves. So if you like wine, red wine, my favorite is Malbec. Only have one glass, but it is perfect. It will help you wind down at the end of a long day of training. Take care of yourself, sit back, find something funny on TV. Like sometimes I'll just turn on cartoons. I've probably been around my grandkids too much, but anyway, I'll turn on cartoons. My favorite right now that I watch all the time is Boss Baby. I love Boss Baby movie, y'all. And I'll just sit and laugh. Like laughter does the heart good. And when I done had a long week or a long day of training or dealing with, you know, white silence and white violence and trauma, I just like, you know what, let me just come on this TV, get this glass of wine and sit here and laugh to my happy heart's content. So
that is wonderful. Aubrey has put in the chat, the name of the book is The Power of Radical Self-Love. And also in The Body is Not an Apology, The Power of Radical Self-Love.
Yes. And also talks about self-care. Yes, thank you. I appreciate that.
And lots of agreement on wine, the importance of wine.
Yes.
And Martin's series for laughs.
Yes, yes. Laughter, y'all will, oh, I'm telling you, you get you some good laughs. And it's just like, you done had a whole dose of, I tell people, I don't know, whatever medicine will make you laugh the worst. Probably what's the laughing gas stuff they give you at the dentist office? Like, I feel like sometimes I'll be that cheery. But Kayla, where I just be sitting there laughing, and my roommate be like, are you okay? I'm like, oh my God, this is so funny. And I just be dying out and burst of laughter. So, but it makes me feel so much better.
And that's true, Christian. You know, for all of us who do this public health work, you know, it can be daunting. It can be daunting, especially in the period of COVID. So I appreciate the advice to really do radical self-love. Yeah. Drink a glass of wine if you can, you know, and laugh. That's really great advice for all of us.
Yeah, have some, I won't even say girl chats, but like have group chats, like virtual chat ups with your friends. I'm an extrovert, but I have learned in this pandemic, like literally I had to figure out how to continue to like have interaction, because at one moment, y'all, I literally was like, oh, I'm about to go into a depression. Like I could feel myself like get into that space because I'm still doing all the work, but then I'm not getting that normal interaction that keeps me charged. So now I literally like have set up with a couple of my friends, some in North Carolina, one in Virginia, and like once a month, like we're just having these like wine and chats. Some of them don't drink wine. They have this soda. That's fine. Do what works for you. But like chat with people, get on a Zoom, whatever, FaceTime. The Zoom is probably, we all zoomed out. FaceTime it, whatever, hang out. Spend 20, 30 minutes. Find opportunity to get away from the work and literally just to be embracing like who you are, because that will actually charge you to get back to where you need to be to keep moving forward.
Absolutely. Suzanne has shared, let's see if I can see it. So, oh, there we go. That she heard Sonya Renee Taylor on the Unlocking Us podcast.
Yes, and you can follow her on Instagram, Sonya Renee Taylor. yes. Sonya was literally on our board, stepped off, and moved away for a while to New Zealand, but is now back into the States and is actually running this amazing project called Buy Back Black Debt. It's Buy Back Black Debt. So if you follow her on Instagram, definitely you'll learn all about this amazing project that Sonya and then two other of her colleagues have now begun to do, where they're connecting marginalized folks that have debt, excessive debt, to people that actually can help them, that are white folks that can pay, that have generational wealth to be able to pay off that debt. So connect with Sonya on Instagram, y'all. Connect with SisterSong on Instagram or Facebook as well. Our website is www.sistersong.net. You can go there to find out, you know, about all the work that we're doing. I would definitely want to uplift, even for folks that's going to watch recording later, that right now we're actually in the middle of helping 4 or 5 other partner organizations here in Georgia to fight to get Irwin Detention Center closed. They actually have been committing or performing hysterectomies without consent on women that were in Irwin Detention Center, which is actually a ICE immigration center here in Georgia, rural Georgia. So definitely if you want to get connected, there's a petition that's going around on all social media platforms that you can sign on to. We won the first part of the battle, where it's to try to get them to stop, you know, bringing in new people. But now they're literally up against trying to make sure that they get this detention center as well as the other centers that this same company runs in Texas and Louisiana closed down, because the same incidents of eugenics and sterilization is happening in all 3 centers. So those are ways that you can get plugged into the work through SisterSong.
Absolutely. To use our own personal power to amplify the work. That's amazing. Is this, and I just want to make sure I'm clear, this is the what we've seen on the news recently, yes, where there was
whistleblower. Yes, okay, absolutely it is. Mm-hmm.
Thank you for sharing that. You also have some more kudos about Saturday night wine Zooms with friends, recharging batteries.
You got to.
And, yes. And then I know, as I mentioned, my colleague and best friend is on my other login, making sure we're good on the back end. And she and I will add that the information about repaying student loans is very welcome. And we will check that out, as I'm sure many of my public health colleagues will too.
Please do, y'all, get connected. Yes. And you can actually sort this in like your own community, right? So like, just because Sonya's like this, I'm sorting it and doing it, across the country, but like, she's also encouraging other people to think about how do we sort this in each in individual states, right? At state level, because that's what grassroots organizing looks like. There are people in some of these states that hold a lot of generational wealth. Y'all, I come from rural North Carolina, so I know. I might live in Georgia now, but I got all my roots are in North Carolina and reside there. So we know there's some folks there that's got some generational wealth. If y'all need me to help and want to think about it, I'm game. Let's do it. How we sort our own initiative in North Carolina.
I will volunteer to be your first recipient.
All right.
But I want to encourage everybody, if you have any other comments or any other questions, please continue to put them in the chat. We have until 4:15. And Christian, you have just been so wonderful. I know I have personally followed you on Instagram. I made sure to connect with you there. And same with SisterSong. And I believe SisterSong, you all accept donations, correct?
Yes, through our website. You can go to the donate page and donate whatever you would like. You can also become a member. So how did I forget that plug? Because I'm lead trainer, membership and development, right? So thank you, Michaela, for reminding me to get these coins, right? That's like always my last thing, y'all. So membership as well, if you want to join as an individual member, it's $50 annually. That allows you opportunities to serve some of the different trainings we do. We give discounts towards when we have our national conference. We give a big discount for folks that are members. We just had our first ever summer RJ Institute that I actually developed and created for SisterSong. Those recordings are actually accessible only for members. We have 4 of the 5 days, so day 1 through 4. So if you want to be able to look at those, you can actually join also as a member. And I won't talk much about organizational memberships because most public health folks, because I come from public health, you can't join like that. But if you want to join as a member and the 50 is too much, please reach out to me, email me at christian@sistersong.net. Because we've also been known for people that want to be a part of our membership to actually do sliding fee scales, because that's reproductive justice, y'all.
Absolutely. And then we've got a request for information on your training.
Yes. So we have right now our Reproductive Justice 101 training that we've moved to full virtual. We will not be traveling, if at all. We'll look at it in 2021. But we are offering the virtual Reproductive Justice 101 training, which is similar to this presentation, but a little bit more in depth. There's breakout groups. We have time to actually have more large scale discussion. And yeah, definitely if you're interested in that or your organization is, please have them reach out to me again, christian@sistersong.net. And I will have a conversation with folks. Remember, I did say I vet people. So I need to be able to see, it's not going to be a box check, or I will just yeah, you might want to look for someone else.
Thanks for that, Christian. And it's really important. I also want to give a big shout out to Lasagna Tuttle, who was my colleague in organizing this. So big shout out to Lasagna and of course the social work section. Absolutely. And again, what else for you?
Yes, all my social work colleagues, people out there, public health people out there, yes. Because even though I was a social worker, I consider myself a public health social worker, y'all. I did 5.5 years almost at Durham Public Health. So yeah, that's home. It's home. I belong in all these sectors.
You do, and you shine so brightly.
Thank you so much. Oh, y'all, And I'm here to do, what has to be done for us to move this country forward. I'm so here for it. Yeah.
Well, here we are. Yes, go social work section. So we're at time, Christian. Thank you. And thank everybody for joining us today. And we'll be sure to send out Christian's materials. And I hope you all have her contact information so you can reach out and become a member of SisterSong.
Absolutely. Thank you again. Have a great evening, everyone. Thank you, Michaela.
You are very welcome.
Bye.
Bye.